Are you getting a massage every 2 weeks and wasting hundreds of pounds with no long-lasting pain relief? In this video, I'm going to explain why massage isn't getting you anywhere and 5 exercises that you can do instead that are about 100 times more effective. I've had loads of friends of mine and previous clients say they've been to sports massage therapists or physios or whoever it is that's giving them the massage. I asked them, why do you think this works? And they say, oh, I come out, I feel really, really good for a few hours or a few days. And I say, oh, is there an end date to this? And they say, no, I just have to keep going back to that for maintenance to relieve these tight knots or tight muscles and help with the pain. Just going and getting a massage, so just rubbing the muscles or relieving the tissues, is going to give you some form of pain relief because your brain is going to send some pain relief to the area where the person is giving you a massage. But you're not actually improving any of the things that matter when it comes to fixing lower back pain. And you want to think of this a little bit like filling up buckets of water. And we've got several buckets to fill up. We need to improve your strength, we need to improve your mobility, and we need to improve your confidence. And then the other bucket that we actually need to take water out of is pain. So we want to reduce your pain as all of these other three things improve. Now, massage is giving you some pain relief, but it's not focusing on those other three buckets. And improving those other three buckets, filling up those other three buckets, improving your strength, mobility, and confidence will reduce your pain in the long term. Instead of going around this cycle where you have to keep going back for a massage every 2 or 3 weeks and you won't get anywhere. So the first exercise is the pelvic tilt. Now you want to think of this a little bit like when you first started learning to drive and you had to get your clutch control dialed in. That was kind of the basic thing, the foundation you had to do before learning anything else. So set up lying down on your back, knees bent, nice and relaxed. I want you to think about your pelvis like a bucket of water. So you're going to tip that bucket of water forward as your lower back comes off the floor and your pelvis rolls forward. And then you're going to bring it back into the floor as you tip that bucket of water back, and your lower back will be nice and flat into the floor. Practice this movement, do it as slow and controlled as you can. I don't want you to tense and brace really hard when you're doing this. Practice this 3 or 4 times just to get used to the movement. Once you've got that nailed, then I want you to coordinate some breathing with that as well. So as you roll that bucket forward and your lower back comes off the floor, I want you to inhale through your nose, nice and deeply, nice and slowly, and then exhale through your mouth as your lower back comes flat into the floor. Do this for 3 to 5 breaths, just get used to the movement, and you can go through 2 to 3 sets of this. This will feel really, really nice. Exercise number 2 is the scissor slide. This is a little bit like 2 people carrying a sofa without dropping it. And the 2 people are your hips and lower back. The 2 people have to coordinate the movement and communicate effectively to not drop the sofa and get in the right position. So set up lying down on your side next to a wall. Take your shoes off for this. Best do this barefoot. Knees bent at 90 degrees. Get your feet flat on the wall and imagine you've got paint on the bottom of your feet so you can't move them off the wall. They're stuck on the wall, they don't move. From this position, pop one of your hands on your top hip or on your glute, on the outside of your glute, and then you're going to very slowly shift or roll that top knee over that bottom knee, forward and back. It's a very, very subtle movement. Your feet shouldn't be moving at all when you're doing this. All that movement should be coming from that top glute, and also you'll feel some opening in that kind of tailbone area just above your glute going into the lower back. Go for 2 to 3 sets, anywhere from 15 to 20 reps. I don't want you to rush this and go fast at all. This is a sensation exercise. And again, it's teaching you to get the hips and the lower back to work together and coordinate that movement. Exercise number 3 is the half kneeling reaches. Think of this a little bit like wringing out a wet towel or some wet clothes when you need to dry them. And you want to think about your spine like this. If your spine doesn't rotate and it doesn't move in a variety of ways, then it can become stiff. And potentially this can be one of the causes of pain, especially in that lower back area. So set up in this half kneeling position, grab a light weight, so a 2.5 to 5 kilo plate. First one is rotations. So make sure your head is looking forward and that doesn't change position. And then you're going to rotate your arms side to side and you'll get some rotation through your mid and upper back. The second position is then reaching overhead, side to side. Again, head stays looking forward. And then you're going to reach and alternate side to side. As you reach one way, you can let your hips come out the opposite way. So as you reach right, let your hips come out left. And then as you reach left, let your hips come out right. Do 4 to 5 reaches in each of these positions on that leg and then swap to the other leg. Next, we've got the tall kneeling med ball scoop pass. So grab a light med ball that's 1 to 2 kilos, that's quite bouncy. And you want to think of this exercise a little bit like a boxer throwing a punch. When a boxer throws a good punch, all the power comes from their legs, not from their upper body. So it's trying to join these two things up. Set up in this tall kneeling position. Grab that med ball like you're going to do a scoop pass in rugby. So hands at the back of the ball. And then you're going to bounce it off the ball for 5 to 15 reps. I want you to go at 25 to 50% of your max power. Finally, we have the tall kneeling round the world slam. So a similar analogy to the previous exercise with a boxer throwing the punch. So set up in the tall kneeling position and then alternate a slam each side, very simply. Go for 25 to 50% of your max power. So again, the goal here is not to put down loads of force. It's just to teach you about a different way of moving.